I'm Rob Abbott, Chief Executive Officer of ISPOR, and I'm really happy to have an opportunity to talk about our bold new strategy, ISPOR Strategic Plan 2030. This is an incredibly exciting time in the world of healthcare. It's also an incredibly challenging time. Big changes occurring with respect to accessibility and affordability, the onset of new ideas such as whole health, and our strategy is poised to address those changes and those challenges. Joining me for this conversation, President-elect Ebere Onukwa, President Brian O'Rourke. I want to talk a little bit about the journey that's brought us to this moment, as well as highlight some of the key components of our exciting new vision. Our Health Sciences Policy Council authored a visioning paper that considered the past, the present, and the future of health economics and outcomes research, and crucially, where that field of health economics and outcomes research could have the greatest leverage in informing healthcare decision-making. We also considered the efficacy of our science strategy in light of the bold changes that are occurring in the healthcare ecosystem globally. All of that, of course, has been distilled through countless consultations with our members and other key stakeholders, and has resulted in the strategy that we're talking about today. And I'm particularly excited about our bold new vision, a world where healthcare is accessible, it's effective, efficient, and affordable for all. I'm excited about this for so many reasons because my entire career has been dedicated to improving human welfare globally, and this vision speaks directly to that. We want, as an organization, to help make healthcare globally accessible for everyone who needs it. We want that healthcare to be effective, to deliver the treatments that people need when they need it. Those treatments need to be effective and actually lead to an improvement in health that enables people to live lives that they aspire to. And perhaps most importantly, that healthcare needs to be affordable. We know this is an audacious vision, but over the next several years, we are dedicated to making it a reality. Ebere, can I invite you to talk a little bit about the mission that on a day-to-day basis now drives us towards the realization of that vision?
Thank you, Rob. I'm excited to talk about ISPOR's mission, which is to advance health economics and outcomes research excellence to improve decision-making for health globally. There's a lot in that mission that pulls out our identity. One is to advance health economics and outcomes research excellence. We are already a go-to resource for understanding about the latest HEOR methods through our task force reports and our guidance on reporting health economics and outcomes research, all of which are well cited in the literature and also pulled in by decision makers. It's really an exciting time for ISPOR to be shepherding the use of HEOR methods. I also like the focus on improving decision making, because that's what health economics is about. It's about understanding trade-offs and really bringing that concept of quantifying that decision to help improve decision making. And I recall during our conversations being really intentional about global health and really embracing the global membership base that ISPOR really has been blessed to have. And to think about not only advancing that science globally, but really committing to capacity building, part of our global mission.
That's a fantastic way of characterizing the mission, Ebere. Thank you. Brian, I'd like to bring you into the conversation. Can you say a little bit about the new values, our organizational values that are really infused into the strategy?
Thanks very much, Rob, for inviting me to participate in this discussion with Ebere on our new strategic plan for ISPOR 2030. We felt it was really important to develop core values for the organization, values that are so important in our decision-making, in our prioritization, in everything we do as an organization. At our board retreat, we brainstormed, we tried to come up with what were those, and we wanted it to be six core values, and we wanted to understand which ones were most important to us. So we did come up with the 6 values being transformative, scientific, inclusive, collaborative, transparent, and ethical. Now, those are just words on a piece of paper. What we will be doing is articulating what those actually mean to the organization as we continue to implement this new vision and this new strategy for the organization.
Thanks so much, Brian. And I think you'll get a feel now for why we're so excited about Strategic Plan 2030. This bold vision, animated by the mission and brought to life by these core values that really are going to signal to our membership and to the wider global community that ISPOR is stepping forward and facing down these challenges and seizing these opportunities in global healthcare. We will take bold positions. We will leverage the science to bring the evidence forward to make sure that we get great policy grounded in great science. And as we do all of that, we'll be inclusive, we'll be collaborative, we'll always be transparent, and above all, we will be ethical. So I'm enormously excited about this opportunity ahead of us in our organization, and I invite all of you to join us on this journey. Thank you.